Hey, this is Chris. It's day 89 in my video diary and Tuesday, May 26th. And earlier today, I had a visit at the UNC Cancer Center. I've been going to the Duke Cancer Center both in Raleigh and Durham for my treatments, but recently had some friends who helped uh, give me a visit at our appointment at UNC to see what options and clinical trials might be available at the University of North Carolina Cancer Center. And so I went in today and was there for several hours and met with a doctor and a couple of interns there at the hospital. And I learned a lot of interesting stuff today. I think I didn't quite hear the news that I was hoping for, um, but I did learn a lot at my visit today. It was somewhat frustrating because uh, not only did we have to wait a long time, but I've kind of expected that with most of my cancer visits today. But it was frustrating in that there currently didn't seem to be any open trials that pertain to my form of cancer. Another thing that was frustrating is that I've recently learned that really to qualify for some of the clinical trials that are out there or might be coming up, that I really need to have completed or started chemotherapy. And in the beginning, doctors have kind of explained to me that chemotherapy is an option, but they've not really outlined any major benefits from doing chemotherapy. Basically, the only benefits that I've been told I would get from chemotherapy was maybe studies have shown about a 2 month extension in life, and maybe some reduction in pain. Um, but that's about it. In some other forms of cancer, chemotherapy is used to treat and reduce the size of a tumor, put certain types of cancer into remission, or even cure cancer. But in mesothelioma, no one has told me that chemo could put my cancer into remission, or reduce the the growth of the cancer at all. And I've been reluctant to do chemotherapy um, because of the side effects and what little benefit I might get from it. Um, but what I'm now learning is to qualify for some of the clinical studies for some new class of drugs, even some of the new immunology drugs, is that I may need to have completed chemotherapy first. So that now adds another decision that I'm going to need to make, is if I'm going to do chemotherapy for that reason to potentially qualify for clinical trials, and then you know have to live or manage the side effects that go along with chemotherapy. Another kind of frustrating thing that happened at my appointment was um, something that sounded promising, but at the same time was a little out of reach potentially. And that is that the doctor talked about the benefits of doing some DNA testing and looking for mutations and helping targeting treatments based on those mutations. And what I learned was that there is a lab that does this DNA testing and can have the results in about 3 weeks. Um, However, insurance companies have got to where they will not pay for this test. And they said it's pretty straight across the board where all the insurance companies have gotten together and will not pay for this DNA testing, which runs about $5,000. So that was a little frustrating to hear, in that there's a test that could help, but it's going to cost me $5,000 out of pocket, and I may or may not learn anything from it that would help my treatment. UNC is doing their own DNA testing, and they did take blood yesterday, and they're doing kind of their own similar DNA testing on their own. However, they're doing it as a research project, and it will take about 5 to 6 months to get the results back, which is substantially longer than 3 weeks for the private lab. So I'm going to need to make a decision on whether or not I want to spend the $5,000 to potentially, do my own DNA testing through the private company to see what we learn from that. So that was another thing that was both promising but frustrating at the same time. And then last, I just keep hearing about, this class of immunology drugs that are coming online. They're helping different forms of cancer. And, almost every doctor I've seen have said that these immunology drugs look promising probably for someone with the type of cancer I have. However, there are so few people with mesothelioma that there doesn't seem to be any trials or any options to use these immunology drugs with the form of cancer I have. And that's frustrating. And even my doctor at Duke said that he thinks the immunology drugs are the way that they'll probably treat my cancer in the future, but he thinks we're about 5 to 6 years out from that. And when you're dealing with an aggressive cancer like I have, that's not very encouraging. So anyway, I learned a lot yesterday at UNC, but I left with a lot of unanswered questions, a lot of things I need to decide, and maybe a little frustrated at the same time. So I'm going to take some time to think about it. I am probably going to need to make the decision soon on whether or not I'm going to do chemotherapy, and maybe make the decision to pay the $5,000 out of my own pocket and do the DNA testing. So we'll see what decision I make, but that's kind of where I'm at now. So anyway, I wanted to share that. That's it for my day 89 video journal entry on Tuesday, May 26th. I will see you tomorrow. Bye.